Hi, in this segment, we're going to be talking about answers to the question, why Kaizen? Why is continuous improvement a necessary and critically important strategy for healthcare organizations today and in a challenging future? If we go back again to Masaaki Imai, I think he spells out very clearly the differences between a Kaizen mindset, which is, of course, deeply embedded in Lean and Toyota's thinking, how that's different from traditional cost cutting. So Mr. Imai says the 4 goals of Kaizen are in this order. First off, to make things easier for the people doing the work, reducing frustrations, allowing people to be more effective, which ties into the second principle, making things work better, reducing errors, improving the effectiveness of a process. Thirdly, making things work faster. Now, we should be careful and make sure this doesn't get interpreted as making people work faster. We want the work to progress more quickly. We want patients to flow without delay. So that means reducing interruptions, downtime, barriers, and often people can feel less pressure to work fast with Kaizen being part of the culture. So instead of having to rush through their work and make mistakes, we can actually reduce waste, free up time to allow people to do things the right way. And then fourth, MI says to make things cheaper, but we don't mean cheap in a negative standpoint. We just mean producing good results less expensively. And again, that means without hurting quality or hurting safety. So we can take a look at how things are all connected from employee engagement through to financial results, with, again, financial results being an end result. So we can talk about employee engagement. That can lead very directly to better financial results if we have happier, more engaged employees, turnover goes down, we reduce the costs that are involved in hiring and replacing and retraining new staff. But employee engagement, again, not just because it's a nice thing to do, it drives results in other areas. It can drive results in patient satisfaction. I believe the adage, if you take care of the employees, they can take care of the patients. Happier patients can lead very directly these days with HCAHPS surveys to the bottom line. Happier patients can also lead to increased patient volume. If your hospital health system reputation has increased and people are more likely to choose to come get healthcare from you, that can then flow through to the bottom line. Employee engagement can drive improvements that increase throughput, allow us to see more patients and reduce waiting lists, which can again drive bottom line results. And then we'd also look at quality. Employee engagement, quality, and safety are highly correlated. I would argue there's good causation there. If we're taking care of the employees, they are going to have better processes that they're improving, which lead to safety and quality improvements, which again can lead to benefits on the volume and financial results side. So it's all connected. But I think one thing we see that is maybe not ironic, but maybe unintuitive, is that in a Kaizen approach, we can get better financial results by not focusing so much on those financial results. We engage people by talking about interruptions, frustrations, patient care, quality, safety, knowing that that's going to flow through to measurable bottom line results. And on that note, when we look at goals and results, ThedaCare is one of a growing number of organizations that have what they call a strategy deployment process, where they're trying to specifically tie true north goals and measures to their Kaizen and daily continuous improvement process. So, it's important to challenge employees to just identify problems that they see on a daily basis, what bugs you. But we also want to challenge employees to come up with improvements that drive results in our local departments and the health system as a whole. So you see ThedaCare's categories of safety and quality, people, delivery, cost, and productivity. Managers can engage employees and ask them to come up with ideas that would reduce, for example, OSHA recordable injury rates. We want to help get people aligned around what the organization is doing. And if we're taking care of people and responding to their ideas and working with them in a collaborative way, they're going to view improvements to the organization as being win-win. And we want to be able to share these goals with people to help point them in that direction. And finally, if we want to measure an ROI of Kaizen, we can take a look at a number of categories. We can look at cost savings. You see on the bottom of the slide, voluntary staff turnover is one key objective. There's a CEO we interviewed for our healthcare Kaizen book who said, the only ROI I'm looking for with Kaizen is reducing voluntary staff turnover, and that has a multi-million-dollar impact on the health system. But we can also look at hard savings in terms of materials, labor, equipment, cost savings that actually allow us to reduce the budget or to see more patients with the same budget. We also might look at what we call cost avoidance or soft savings. That might include staff time that's freed up. Now, if we're not reducing overtime or reducing labor spending, we might be redeploying that time to better patient care, which is going to lead to better quality, better safety, flows through to the bottom line, but it might be more of an indirect connection. And then, as we looked at an example before, Kaizen doesn't just mean cost reduction. It can also mean revenue increases, capacity increases, more accurate billing. There was that pharmacy example of getting more patients to use the internal pharmacy. That can have a big effect on the bottom line as well. So we have questions for reflection. First off, what are your organization's goals for Kaizen? What are you trying to accomplish? What direction are you going to try to point people in? And why is Kaizen important to you personally? If we ask this question, why Kaizen? Why do we need employee engagement? Why do we need continuous improvement? Let's talk about that through the online discussion that we have here. Thanks.